What if the blood pressure medication meant to protect your heart is actually causing your legs to swell? Many people notice puffy ankles, tight shoes, or swollen feet and assume it's just aging, salt, or standing too long. But here's the surprising truth. Some of the most commonly prescribed blood pressure medications can cause leg swelling as a side effect. Hello, if you are watching me for the first time, my name is Nicholas and I am a pharmacy practitioner. If you or someone you care about is taking medications for high blood pressure, this video is very important because leg swelling is one of the most common side effects patients experience. Yet, many people don't realize their medications could be the real cause of these swellings. In today's video, we look at 7 blood pressure medications that can cause leg swelling, explain why this happens, and most importantly, what you should do if you notice swelling in your feet, ankles, or legs, okay? So make sure to watch until the end because one of the medications on this list is one of the most commonly prescribed blood pressure drugs in the world. Before we look at the specific medications, it is important to understand why this swelling happens in the first place. Leg swelling, also known medically as peripheral edema, occurs when the fluid builds up in the tissues of the lower legs, ankles, or feet. This often happens because of the changes in how blood flows through your blood vessels. Many blood pressure medications work by relaxing and widening blood vessels. This process helps to lower blood pressure and make it easier for the heart to pump blood through the body. However, in some cases, this widening of blood vessels can cause fluid to leak from the small blood vessels into the surrounding tissues, especially in the lower parts of the body where gravity pulls fluid downward. That is why people may notice symptoms such as swollen ankles or feet, shoes feeling tighter than usual, indentations in the skin when you press on it, and heaviness in the legs by the end of the day. For many patients, the swelling is not dangerous, but it can be uncomfortable and concerning, especially if they don't know what is causing it or what is the cause, okay? Now let us talk about the 7 blood pressure medications that are most commonly linked to these types of swellings. Well, the first medication on this list is Amlodipine, and this is probably the most common blood pressure medication associated with the leg swelling. Amlodipine belongs to a group of medicines called calcium channel blockers. These medications work by relaxing and widening arteries, which helps to lower blood pressure and improve blood flow in your arteries, okay? Because of its effectiveness and safety profile, Amlodipine is one of the most widely prescribed blood pressure medications in the world, especially for older adults and patients with long-term hypertension. However, one of its well-known side effects is ankle and leg swelling. Here is why it happens. Amlodipine widens the arteries significantly, but it does not relax the veins as much. This creates a situation where the blood flows into the legs more easily but doesn't return to the heart as efficiently. As a result, fluid pressure builds up in the small blood vessels of the lower legs, causing fluid to leak into the surrounding tissues. This leads to swelling in areas such as the ankles, the feet, and the lower legs. Many patients notice that the swelling gets worse later in the day, especially after standing or sitting for long periods of time. The important thing to know is that this swelling is usually dose-related, meaning it becomes more likely at higher doses, such as if you take the 10 milligrams of Amlodipine. But don't worry, later in this video, I'll explain what you can do if your blood pressure medication is causing your legs to swell, because in many cases, there are simple solutions, okay? The second medication that can cause your legs to swell is Nifedipine. Like Amlodipine, Nifedipine also belongs to the calcium channel blocker family of blood pressure medications. These drugs are commonly used to treat high blood pressure and certain heart conditions because they help to relax and widen the arteries in your body, which then allows blood to flow more easily. However, this same effect can sometimes lead to swelling in the feet and the ankles of your legs, okay? When nifedipine widens the arteries, it can increase the pressure in the small blood vessels of the legs. Over time, this pressure can allow fluid to move out of the blood vessels and into the surrounding tissues, which then leads to the visible swelling. Patients taking nifedipine may notice symptoms such as the following: swollen in the ankles, puffy feet, and a feeling of heaviness in the lower legs. In many cases, this swelling becomes more noticeable towards the evening, especially after spending a long time standing or sitting during the day. Extended release forms of nifedipine, which are commonly prescribed today, are generally better tolerated, but swelling can still occur in some individuals. Remember, when I say extended release form of amlodipine, I mean the formulation that is manufactured to be released slowly in the body during the process of absorption, okay? Now, let us move on to another medication in this family that can also cause your legs to swell, although many patients don't realize it immediately. This third medication that can cause your legs to swell is felodipine. Felodipine is also part of the calcium channel blockers group, the same family as amlodipine and nifedipine. Doctors prescribe it because it effectively lowers blood pressure by relaxing the arteries, which reduces the workload on your heart. However, like other medications in this class, felodipine can sometimes cause peripheral edema, meaning swelling in the feet, ankles, or your lower legs, okay? One reason this medication can be tricky is that the swelling often develops gradually without you knowing. Patients may not notice it immediately, and over time, they may assume the swelling is related to aging, reduced activity, or even weight gain. But in reality, it may be a side effect of this medication. Felodipine-related swelling is more likely to occur in the following people: older adults, patients taking higher doses, people who stand or sit for long periods during the day. And just like the previous medications we discussed, the swelling usually becomes more noticeable in the evening when fluid has had time to accumulate in the lower legs. The fourth medication that can contribute to the leg swelling is Nicardipine. Nicardipine is another medication in the calcium channel blockers family. It works by relaxing the smooth muscles in the walls of blood vessels, which helps widen the arteries and lower your blood pressure effectively. Because of this effect, Nicardipine is sometimes used not only for chronic hypertension, but also in certain hospital settings to control blood pressure very quickly, okay? However, like other medications in this group of calcium channel blockers, Nicardipine can sometimes cause peripheral edema or swelling in the lower limbs. When the arteries widen, blood flows into the legs more easily, but the veins may not expand to the same degree. This can create increased pressure in the small blood vessels of the legs, which then allows fluid to move into nearby tissues. As a result, patients may notice the following: swelling around the ankles, puffiness in the feet, and also leg feeling heavy by the end of the day, okay? While this side effect is not experienced by everyone, it is something healthcare providers monitor carefully, especially in patients who are already prone to fluid retention. The fifth medication that can sometimes cause leg swelling is Hydralazine. Unlike the previous medications we have discussed, Hydralazine does not belong to the calcium channel blocker family. Instead, it works as a direct vasodilator, meaning it relaxes the muscles in the walls of your blood vessels. This relaxation helps to widen the arteries, which then lowers blood pressure and reduces the workload on your heart. However, one effect of this widening is that the body may respond by retaining more fluid and sodium. When this happens, some patients may develop fluid buildup in the lower legs, which then leads to the swelling in the feet and the ankles. In certain cases, hydralazine may also cause the body to increase heart rate and activate fluid-retaining hormones, which can further contribute to fluid retention. Okay? Because of this, doctors sometimes prescribe hydralazine together with a diuretic, also known as a water pill. This helps to prevent excess fluid build-up in your body. Patients taking hydralazine may notice the following signs: mild ankle swelling, weight gain from fluid retention, and leg feeling heavier during the day. Now, the next medication on this list is much stronger and usually reserved for the blood pressure that is difficult to control, but is also known to cause significant fluid retention in your body. This medication, which is our number 6, is called Minoxidil. Minoxidil is a very powerful vasodilator, meaning it strongly relaxes and widens blood vessels. Because of this strong effect, doctors usually reserve it for severe or resistant hypertension when other blood pressure medications are not working well enough. While Minoxidil can be very effective at lowering blood pressure, it also has a high likelihood of causing fluid retention. When blood vessels relax significantly, the body may respond by holding onto sodium and water. This can lead to noticeable swelling in the feet, ankles, and legs. For this reason, Minoxidil is almost always prescribed together with a diuretic, which helps the body to remove excess fluid and reduces the risk of swelling. Patients taking Minoxidil may experience the following signs: significant ankle or leg swelling, rapid weight gain due to fluid retention, and a feeling of heaviness in the lower legs. Because of these potential side effects, doctors typically monitor patients closely when they are taking this medication. Okay, now let us move on to the final medication on our list, which is also widely used for heart and blood pressure conditions, but may still cause swelling in some individuals. This medication is our number 7 on the list, and it goes by the name Diltiazem. Diltiazem is also part of the calcium channel blocker group, but it works slightly different from medications like Amlodipine and Nifedipine. In addition to relaxing blood vessels, Diltiazem also affects the heart's electrical activity, which is why doctors often prescribe it not only for high blood pressure, but also for certain heart rhythm conditions. Okay? When compared to other calcium channel blockers, leg swelling with Diltiazem is generally less common, but it can still occur in some patients. When it does happen, the swelling is usually mild and may appear as follows: slight puffiness in the ankles, swelling around the feet, heaviness in the lower legs after long periods of sitting or standing. Okay? In many cases, this swelling may improve if the dose is adjusted or if the medication is combined with other blood pressure medications. Now that we have discussed 7 blood pressure medications that may cause leg swelling, the next important question is, what should you do if you start noticing swelling in your legs while taking these blood pressure medications? If you notice swelling in your feet, ankles, or legs after starting a blood pressure medications, the first thing to remember is don't panic. In many cases, this is a manageable side effect. However, there are some important steps you should take. These steps include: number 1, do not stop taking your medication suddenly, because stopping suddenly can cause your blood pressure to rise quickly, which may increase the risk of heart attack or stroke. Instead, speak with your doctor or a pharmacist first before stopping your medications. Number 2, monitor the swelling. Pay attention to when the swelling appears and how severe it is. Ask yourself the following questions: does it get worse in the evening? Does it improve after resting or elevating your legs? Did it start shortly after beginning a new medication? This information can help your healthcare provider determine whether the medication is the likely cause, okay? Number 3, elevate your legs when resting. When sitting or lying down, try to elevate your legs slightly above your heart level. This helps fluid to move back toward the heart instead of pulling in the lower legs. Even doing this for 20 to 30 minutes a few times a day can help to reduce these swellings. Number 4, reduce excess salt intake. Because too much dietary salt can cause the body to retain the fluid, which may worsen the swelling. Try to reduce foods such as processed foods, packaged snacks, canned soups, and fast food. A lower sodium diet can often make a noticeable difference. Number 5, speak with your doctor about possible adjustment. If the swelling is bothersome, your doctor may recommend simple adjustments such as lowering the dose you are taking, switching to another blood pressure medication, adding a mild diuretic, that is water pill, to help remove excess fluid. In many cases, this adjustment can reduce or eliminate the swelling while still keeping blood pressure under control, okay? Although medication-related swelling is usually mild, you should seek medical attention immediately if the swelling is accompanied by the following signs: shortness of breath, chest pain, sudden rapid weight gain, and severe swelling in both legs. These symptoms could indicate heart, kidney, or circulation problems and should be evaluated promptly, okay? Now, before we finish, let me share one important insight I often see as a pharmacy practitioner that many patients don't realize, okay? As a pharmacy practitioner, one thing I often notice is that many patients become worried when they see swellings in their legs, and they immediately think something is seriously wrong with their heart or their kidneys. While those conditions can sometimes cause swelling, in many cases, the cause is simply a medication side effect, especially with certain calcium channel blockers like Amlodipine or Nifedipine, okay? Another important point is that this type of swelling is usually not dangerous, but it can be uncomfortable and frustrating if patients don't understand what is causing it. The key is communication. If you notice any form of swelling after starting a new medication, the best approach is to talk to your doctor or pharmacist. Often, a simple change like adjusting the dose or switching medications can solve the problem while still keeping your blood pressure well controlled, okay? Remember, managing blood pressure is not just about taking medications. It is all about understanding how those medications affect your body. Now, I would like to hear from you. Have you ever experienced swelling in your feet or ankles while taking blood pressure medication? If so, which medications were you taking? Share your experience in the comments below, because your story could help someone else who is dealing with the same issue as you are, okay? If you found this video helpful, please like this video and subscribe to this channel. On this channel, I share pharmacist approved tips, medication education, and natural strategies to help you control your blood pressure safely and effectively. If you want to learn more about how different blood pressure medications affect your body, be sure to check out the next video on this channel, okay? Just one last word. Remember this: your blood pressure medication is meant to protect your heart and your health. But it is important to understand how these medications work and their possible side effects, because this will help you to make better decisions about your care, okay? Stay informed, stay proactive, and always work close with your healthcare provider. Thank you for watching, and I'll see you in the next video. Bye.